Hello everyone, welcome back to my channel. My name is Oluwafunto Borokini. I'm a pharmacist, and in this video I'm going to be sharing my life updates, what I've been up to. For about 2 to 3 weeks now, I've not been on YouTube, and as you can see, I'm not where I used to be. Yeah, so I just completed my 1-year internship program at a hospital, and I'm now back home. At the end of this month, I'm on terminal leave currently, and at the end of this month I'll be getting my certificate of experience, which qualifies me to then go for my youth service. Yeah, so pharmacy is quite a long training. After 5 years in school, you still have to do a 1-year internship training. It's a training, but you still get paid while being trained. And after that, you will do your 1-year youth service before you can become a qualified pharmacist in Nigeria. So that is about 7 years in total. Yeah, so in this video I'm just going to be sharing with you some of my experience as a hospital pharmacist, a hospital pharmacy intern. Some of you who are pharmacists may be trying to decide, where do I do my internship? Do I do it in a hospital or a community pharmacy or an industry or an organization? You know, there are so many different arms to pharmacy, so you may be trying to decide where to do your internship. So I'm just going to be sharing with you my own experience as a hospital pharmacist intern, and I will advise anybody to do their internship in the hospital, because just watch the video and you see my experience. When you hear my experience, you want to do your internship in the hospital. So as a pharmacy intern in the hospital, I got to work in different departments, different units in the hospital, exposing me to different drugs, different medications, consumables that are being used for variety of patients, a lot of patients, different categories of patients. Unlike being confined to just one experience, I was able to go through like 12 different units of the hospital and know what is being done for the patients in that area. So as I list them, you can just count along with me. I think there are about 12 or so, but as I list them, as I talk about them, just count along with me. So I'm going to be talking first about the GOPD, the General Outpatient Department Pharmacy. So basically at the GOPD pharmacy, we have patients coming in to get their prescription drugs, and they will go home after them. When patients come, what you do is that you assess the prescription, you make sure that there are no errors in the prescription, and you make sure that the drugs are suited for the patients, there are no contraindications, you make them aware of the side effects, and you know, basically the job of you do the job of the pharmacist. You give proper counseling and you let the patients go. The patients go home and take the medications till their next visit to the hospital. Then we also have the inpatient pharmacy. This one is for patients that are being admitted in the wards. You know, we have different wards like female and male medical wards, surgical wards, pediatric wards, and all of that, all the wards. That is what the inpatient pharmacy cater for. So here you get to see a lot of infusions and infusion items. You get to see a lot of consumables, injectables, and you still see tablets as well. Then also in the inpatient pharmacy, we have the theater pharmacy and the operation packs units. Those are like units under the inpatient. So at the theater pharmacy, those ones cater for patients in the theater, you know, patients that are going surgery and all of that. The OPU, that's the operation packs units. Here we do packs for patients that are preparing for surgery, you know, rather than rushing to get all the items together. You have the items pre-packed so that you don't keep the patients waiting for a long time. We also have the children emergency department pharmacy. So at this pharmacy, of course, you have to be very acquainted with pediatric dosage forms, you know, the strengths, the doses. You have to be very careful because here you're dealing with children, so there's a lot to learn about children formulations and how to dispense properly, how to give proper advice to the patient's caretaker. We have the community health department. When you hear community health department, of course your mind will go to pregnant women. We have ophthalmology department, which takes care of the eyes. So here you're going to be seeing pharmaceuticals relating to eye care. We have the medical care, the surgical care of the eye. You're going to be learning about all of that. Another very interesting department I worked is the ARV, that is the antiretroviral pharmacy. In this place, we take care of antiretrovirals for HIV patients. I made a video earlier sometime in December where I said that I was working in ARV in December, in the month of December 2021. And I said I was going to share my experience there in a video. I have not yet made the video. So I think, thank God, I'm remembering now. So I'll have it in mind that I have a video to make about antiretrovirals. Very interesting stuff. Another very important or very interesting department to work in the hospital is the A&E, the Accident and Emergency Department. As the name implies, accident and emergency. So you should know that they are going to be bringing a lot of emergency cases. So you get to learn a lot about emergency drugs that should be readily available in the pharmacy in case of emergencies. You're going to be learning a lot about this in the A&E. You're going to be seeing a lot of things, you know, you're going to be wild and all of that. So this is a very interesting unit to work. We also have the NHIS pharmacy, that is the National Health Insurance Scheme. So this is more like the GOPD also, because the patients will come, you dispense to them, you counsel them on how to use the drugs, and they go. The only difference here is the price. Like, they're just going to be paying about 10% of the actual cost of their drugs. Yeah, so the three other units where I worked, where we have one we call the PFMU, we have PIMD, and we have SSMU. So let me just tell you about those three, because they are not what you will usually hear. So PFMU is Pharmacy Financial Management Unit. This is where they deal with, like the name implies, pharmacy financial management. So we're managing finances. You know, in the hospital, sometimes you give patients drugs on credit. This is the unit where they track all these things. They make sure that you have a record of patients that pharmaceuticals are being dispensed to on credit, and you ensure that when they make payment as well, it's well recorded. This unit also handles the administration of the department generally, like admin work, basically paperwork. You need to pass a memo, you need to pass an information. This unit will train you on that. You will know administrative work from there. Yes. Then we have the SSMU, that is small scale manufacturing unit. So as a pharmacist, you should be able to know you should be able to have some knowledge about compounding. Like when you're in pharmacy school, you're going to be doing pharm tech, pharmaceutics, and you're going to be doing a lot of practicals in the lab. You'll be mixing one ointment or another, doing one tablet, blah blah blah. So at the small scale manufacturing unit, you get to gain experience on compounding, how to do some little compounding of some drugs, how to make some lotions, you know, how to dilute some lotions as well, like methylated spirit, chlorhexidine solution, that's Savlon. You know, you basically have an idea of what it is to do some little small scale manufacturing in pharmacy. Then the PIMD, so Pharmacy Information Management Division. So this area of pharmacy, like the name implies, Pharmacy Information Management Division. So is in charge of compiling information, compiling data about drugs that are being dispensed, drugs that are available in the hospital, those that are not available, you know, those kind of informations. They also deal with pharmacovigilance, that is, they monitor side effects of drugs. When patients complain about side effects, they gather information about that and relate back to regulatory bodies about side effects of certain drugs that are being dispensed to patients. And finally, I almost forgot, store. Oh my god. If you talk to any pharmacist that has worked in any hospital, when you ask them about store, oh god, like it's like that's the normal thing everywhere. The store, they call it Pharmacy Store Logistics Division, something like that. The store is usually the most stressful part of hospital pharmacy work. Like, you can, you know, look at the name, says store, so that's where you have all the drugs in the hospital. So you can imagine how stressful that place can be, because you're going to be receiving drugs from pharmaceutical companies. You're going to be in fact, Well, it may be different in some other hospitals. Where I worked was not really so computerized, so we did a lot of manual work. So in a place where everything is computerized, I think it would have been made easier. But where I did my own internship, we did a lot of things manually, so it was quite stressful. Store, basically where the drugs are being kept. You have to keep proper record of the drugs that you have in the store. You have to issue out drugs from the store to all the various outlets that I've mentioned. You know, I've mentioned a lot of outlets. The store is in charge of issuing pharmaceuticals to all these outlets that I mentioned, the GOPD inpatients and all those that I mentioned here. And then the store is also in charge of receiving pharmaceuticals from pharmaceutical companies into the hospital. They do something called tender. That was one thing I didn't really pay attention to while working. They do like tender, impressed. There's a way they get drugs into the hospital that I didn't really understand. But for some of you that did your internship in the hospital, I'm sure you understand that aspect. Yeah, so as you can see, I must have mentioned about 12 units where I worked. So I got experience from all these various units. So now I can choose to go and work in the community pharmacy or the hospital pharmacy industry, anywhere at all. And I think I won't be so lost. I've gotten an experience of all of these career aspects in pharmacy. So yeah, I would advise you to do your internship in a hospital pharmacy, a good one, like the one I did mine. I did my internship in Federal Medical Center or Ondo State. Yeah, it was a full experience. So that is that about that. I hope I've been able to, you know, summarize and, you know, clearly make you understand what it's like to be a pharmacy intern in Nigeria. Another thing I would just like to also ship into this video is the fact that those that have started my channel with me must have noticed that at the beginning of my channel, I used to make videos about sometimes I'll come and tell you like story time, something that happened at the time in my life that I wanted somebody to learn from, or sometimes I come with like some spiritual topics, you know, different things. But I realized that I needed to find a niche for this particular channel, so I decided to stick with medical and pharmacy stuff. So most times you see that I just come to share my knowledge or some common conditions that you can easily manage in the pharmacy, or you can even manage yourself, or just to expose you to a general knowledge about some things that may be worrying you and you may not know what the problem is. So I talk about health related topics. Yes, health related topics. So that is what this channel is for now. Yes, you must have noticed the trend over a couple of months. I'm going to have another channel much later because I still want to share some things, some personal things, some spiritual topics, some personal life experiences. I'm not too much of a public person. I don't like sharing too much, but I'm just going to have a channel. Sometimes, you know, I want to show you some things like a lifestyle vlog every once in a while. So I'm going to have another channel for that. But for this channel, we're just going to be talking about health. So let's look forward to it. If you're yet subscribed to my channel, please do subscribe. Do subscribe to my channel. Join this I don't know what else to call it, family. Join this channel. Subscribe to my channel. And do not forget to like this video. Please do like this video so it can reach more people. Subscribe to my channel. If you have any questions about hospital pharmacy in Nigeria, hospital pharmacy internship, as you know, internship, because not like I'm a hospital pharmacy internship in Nigeria or in where I did mine, you can ask in the comment section below. If there is anything you would like me to talk about subsequently in my subsequent videos, you may also put that in the comment section below. As you can see, I'm now in my house, so that is why I have this new background. I'm now at home. I'm no longer interning where I was interning. That is where I was doing my videos previously. That was where I started my YouTube journey. So this is where I'm going to be having my videos now. Thank you guys for watching. Thank you so much. Like I said, I've missed you, and I'll try to drop a video every week from now on. I'll try my best possible to be very consistent, because there is always something to learn. I have a lot of topics in my, that I've written down that I want to talk about. So please do subscribe and do click on the notification bell so that as I upload new videos, you can be notified and you can also get to learn something. Please share my videos. These videos are not just for you. Share it. Thank you so much for watching, guys. I've taken too much of your time. Thank you for watching, and I'll see you guys in the next one. Bye.